Welcome to the fourth and final episode of this 2023 AARP virtual series on brain health. This week's program is Addressing Race and Gender Disparities in Dementia and Brain Health. I'm Lisa Dedden Cooper, and I'm coming to you from the AARP Michigan office. And I'm so happy to be your host once again as we discuss what we all need to know about brain health so we can become more empowered on behalf of ourselves and our family and friends and our communities. During our first three episodes, we talked about what dementia is and the 6 pillars of brain health, how to talk with your doctor about your cognitive health, and where to find services for different types of dementia or adult neurocognitive disorders, as they're sometimes called. And now today, we're doing a dive into some of the questions that have really intrigued me from the time I first heard these statistics. Why are women twice as likely to develop Alzheimer's as men? Why are African Americans and Hispanic Latino Americans more likely to develop dementia than non-Hispanic white Americans? And what is it about our race and gender or other demographic factors that makes what happens to our brains tend to be different as we age? To answer these questions and more, we've invited two special guests to join us today. AARP's Senior Vice President for Policy and Brain Health, Sarah Locke, who is the Executive Director of the Global Council on Brain Health, and Dr. Lisa Barnes from the Rush Alzheimer's Disease Center at Rush University Medical Center. And she also serves on the governance committee for the Global Council on Brain Health. We'll hear from them in just a moment. And then for the rest of the hour, we want to hear from you, and we'll take your questions live. So if you have questions or comments during today's program, please feel free to type them in the chat box that you will see on your screen just underneath the box that you're looking at right now where the video is playing. Then, after we've heard from both of our speakers, we'll answer as many of your questions as possible. But first, what is this Global Council on Brain Health that I mentioned? So, beginning in 2015, AARP convened the Global Council on Brain Health, an international collaborative of scientists and health professionals and policy experts working in the field of brain health from around the globe. In particular, the Global Council on Brain Health focuses on brain health relating to people's ability to think and reason as they age, including aspects of memory and perception and judgment. Since 2016, the Global Council on Brain Health has brought together over 200 experts from 28 different countries, representing over 150 different universities and organizations to reach a consensus on the state of the science. You can see here some of the logos and names of some of those partners. To date, they have published 13 reports and about 15 infographics, and their materials are available in 5 languages. On this slide, you can see just a sample of some of the titles. Today, we are going to focus on a report that just came out this summer, Building Better Brain Health for All People. We're going to hit just some of the highlights today, but if you'd like to read or download a copy of this report, you'll be able to find it by going to the Resources tab. Again, this is right underneath the screen where our video is playing. As before, our goal today is for you to leave this program feeling more informed and empowered and hopeful than you started out. And this report includes recommendations both for individuals and for policymakers and for community leaders. But now it's my great honor to introduce our guests today. First, I'm joined today by Dr. Lisa Barnes. Dr. Barnes is the Aloe V. and Solomon Jesmer Professor of Gerontology and Geriatric Medicine and a cognitive neuropsychologist within the Rush Alzheimer's Disease Center at Rush University Medical Center. Dr. Barnes received her PhD from the University of Michigan in biopsychology and completed her postdoctoral fellowship in cognitive neuroscience at the University of California. Her research focuses on disparities in chronic diseases of aging, cognitive decline, and risk factors for Alzheimer's disease, and she has published over 300 manuscripts. Next, Sarah Locke is AARP's Senior Vice President for Policy and Brain Health and the Executive Director of the Global Council on Brain Health. She's a frequent writer and public speaker on issues related to brain health and healthy aging and has appeared in media outlets including the New York Times and NPR, Good Morning America, the Washington Post, CBS News, and more. Sarah received her bachelor's degree from Franklin and Marshall College and her law degree from the University of Maryland School of Law. In just a moment, we're going to hear from each of our guests, one at a time. But first, while we're all together on the screen, I'd like to ask each of you to give us a taste of what you're going to share with us and what you hope our viewers will take away from today's program. So let's start with Dr. Barnes. What do you want our viewers at home to be prepared to learn from you here today?
Thank you, Lisa. It's a pleasure to be here. I think today the most important points I want to convey is that Alzheimer's disease is a health disparity that affects some populations more than others. And you're going to be very surprised to know what we're finding as are some of the factors that influence Alzheimer's disease.
Thank you. Thank you. And Sarah, what about you? Oh, Sarah, if you can hear me.
There was a little bit of a bandwidth problem, Lisa, but I think what you wanted to ask me is a 1 minute highlight. And just to say that I think the most important thing is that people understand there are things you can do to impact your brain health. It is not a fait accompli. In fact, 80% of where you end up is affected by yourself, your environment, and things around you. You also asked for some surprising things, and I couldn't decide which of the two I think are most surprising. So I'm going to give you both. And that is, I think people are going to be surprised to learn that their brain health, it's not just a matter of waiting until you're 60, 70, and 80 to figure out what's going on with your brain health. This is applicable to people of all ages, young, middle-aged, and older. So I think that that's surprising to people to realize that brain health is an issue for across the lifespan. And then the other is people assume that the healthcare professionals they're going to know everything about cognitive health and can give them all the information they need. And I think it's surprising that that's just not true. You really have to find people who are specialists to know things about this. Your primary care physician probably has not gotten a lot of training in this stuff.
So important to know. And I love how much knowledge and experience each of you bring. So hey, let's dive in. Dr. Barnes, when it comes to dementia and brain health, what sorts of racial disparities exist? And what do we know about why they exist? And what can we do about them? And as a reminder for everyone at home, if you have questions as we go along, feel free to type them in the chat box underneath the video on your screen.
Thank you, Lisa, for those questions. Good morning, everyone, again, or afternoon, wherever you might be in the world. I really want to thank AARP for putting on this great webinar to convey some really important information because, as you heard from Sarah, there are things that we can do for better brain health, but it really all starts with education and awareness. So today, we know that dementia is a growing health concern for our aging population. Today, 1 in 8 older Americans is affected by Alzheimer's disease and other dementias. It's also a very costly disease, costing more than $200 billion a year, which is only going to get worse as our population ages. Because Alzheimer's disease is a disease of aging, we know that with future projections, it's estimated that the oldest age groups are going to grow more rapidly than any of the other age groups. And so that we will have about a little bit over 13 million Americans in the US will have Alzheimer's disease by the year 2050. So think about that. That is less than, where are we now? 2023? That's less than 25 years or less than 30 years from now. We're going to have almost 14 million individuals affected by this disease. Thus, prevention is a public health priority. So, what we also know is that Alzheimer's disease, as I indicated in the opening, is what we call a health disparity. Did I change my slide yet? I don't think so. I'm sorry. Slides won't move now. Okay, here we go. So sorry. But we also know that Alzheimer's disease is a health disparity. And you might be surprised to hear this, that older African Americans bear a disproportionate burden of Alzheimer's and cognitive impairment compared with other racial and ethnic groups. In fact, it's been estimated that the incidence of Alzheimer's is almost 2 times higher in older African Americans than in other racial and ethnic groups. It's also about 1.5 times higher in Latino or Hispanic Americans. Now, we don't really fully understand all of the reasons for this increased burden, but research in this area is very active, and we're really trying to uncover what some of the reasons might be. So one of the things that we think is involved in this disproportionate burden for some populations is what we call social determinants of health. We know that there's really no biologic difference between different races and ethnicities. You know, our biology is the same, but social determinants, or what the social conditions in which people are born, live, work, and age, we know that these social conditions vary across populations. So people live in different environments, they have been born in different circumstances, and we believe that differences between populations in Alzheimer's are largely due to the poor social conditions that we know are associated with race and ethnicity in the US. So things like having lower wealth or fewer years of education, having more experience of discrimination, or less access to quality health care. All of these factors from our data across many different studies across the country are pointing to these as potential roles in Alzheimer's disease. We also know that there are other factors that we think play a role, and this includes a higher level of vascular disease, like having hypertension or diabetes. We know from research that these types of vascular diseases are associated with Alzheimer's disease. They're also more likely to be present in people racialized as African American, or people who come from Latino and Hispanic backgrounds. So having more of these vascular diseases also puts you at higher risk of having Alzheimer's disease. And then there's also data suggesting that living in neighborhoods where there's a lot of social disadvantage or poverty, that those things also play a role in people having a higher risk of Alzheimer's. So, you know, there's a problem that we face in our scientific field, in that, we've learned so much about Alzheimer's and our knowledge base has really advanced, especially within the last 20 years. But most of the knowledge that we have is coming from research studies that have been predominantly of older white adults. And we can't always make the assumption that what we're learning in one population applies to other populations. So, at least for people where I work at Rush and other institutions across the country, we have really, really started to focus in on one area that we think is going to really make a difference, and that is to try to recruit more diversity, have more diverse people participating in research. And so the goal has really been to enroll people from underrepresented populations who we know might have different risk factors and life experiences. Some of those things I talked about on the previous slide, people who come from different neighborhoods or backgrounds, have different social determinants. We need to have more of that represented in our research studies. Also, we need to be able to have more culturally sensitive outreach efforts and ongoing community-wide education. That is really going to be required in order to overcome some of the barriers that we know are responsible for having low representation of many African American individuals and other races and ethnicities in our studies. And because Alzheimer's is a disease that develops slowly over time and progresses slowly for many people, we need to be able to keep people in our studies. So retention of participants is really, really important, especially from these diverse backgrounds, so that we can really understand in some of our longitudinal work how this disease progresses over time and how people are affected as the disease progresses. And ultimately, better data from different populations will facilitate the development of interventions, policies, and improve therapeutics so that we can really begin to address these health disparities. So as you heard, the Global Council on Brain Health just issued a report on building brain health equity. So excited about this report. It was published just this summer in June 2023. And it came from a series of meetings, 4 meetings that we convened of issue experts from across the country, across the world, really, and people who had lived experience. So we really incorporated all of this into this report. And I really encourage you to go to the resource tab and download the report so that you can see some of the exciting discussions that we had at these meetings. Because we're not going to be able to cover everything today, but there'll be some really exciting things for community stakeholders, for individuals, for all kinds of people, policymakers. There's something for everyone and for individuals as well. So the Global Council on Brain Health defines brain health equity as the fair and just opportunity to have a healthy mind throughout a person's life. So just think about that. We are all born into different circumstances, different environments, but in order for us to have brain health equity, we have to have the opportunity, the fair and just opportunity to have a healthy mind, right, throughout our life. Our mind and our brain should not be determined because we happen to come from a poverty-stricken neighborhood, or we happen to have less access to healthy foods and vegetables. We all have to have the fair and just opportunity. And so the report is going to really go into what are some of the things that we can do to make sure that becomes a reality. And so when you look at the report, you will see that there are a number of elements that we outlined that are needed to build better brain health. And I want to just briefly go through a few of the ones that I am really, really excited about, that I think we can all get our heads around. So the first, which is actually highlighted, is inclusive research. So I am a researcher at a medical center in Chicago, and I focus on trying to understand risk factors for Alzheimer's disease in older African Americans, because, as I told you, older African Americans have been underrepresented in a lot of this research, and it is really important to be able to hear voices of this underrepresented group to understand what are some of the unique social determinants that may be playing a role in this population and potentially leading to a higher risk of Alzheimer's. But another really exciting element that I think we all can be a part of is employer practices. Now, I know that many of you may be outside of the workforce. Maybe some of you are still working. But even if you're not working, you have family members who are working. And I think, I like this element because it's more structural. It's something that, can happen at a higher level. And so employers can reduce the financial and emotional stress on family caregivers for people living with brain health conditions by offering caregiving leave. That's something we don't really hear about. We hear about maternity leave, but we also need caregiver leave. Caregiving leave, having flexible working arrangements, and allowing us to use paid sick leave for family caregiving. Employers also can offer wellness programs and employee incentives to encourage healthy behavior. So that's something that can really be done at a bigger structural level to help us achieve better brain health. But also, in line with that, is more of a government policy angle. So why not make a greater priority of prevention throughout the life course, not just when we get to be 65, 75, 80, but let's start at the very, very beginning, when we're babies, right? And really be proactive for brain health. So let's have the government establish public policies and practices to promote greater awareness and early identification of cognitive and mental health issues. Let's not just wait until, we are outside the workforce and we are in retirement. Let's make this a policy that happens from birth all the way to old age. And then I think finally, the last element that I want to hone in on is healthy behaviors, because that's something that we all can do. And by that, I mean, we need to adopt preventive measures to reduce risk factors for Alzheimer's and related dementias by promoting evidence-based brain health strategies. There's been so much that we've learned over the past couple decades about things that we can do to prevent Alzheimer's. So we can do things like physical exercise, having healthy diets, getting sufficient sleep, managing stress. All of these things play a role in the higher risk of Alzheimer's disease. And these are things that we can do individually to change our own behavior. So it really comes down to, us having a more global approach to the problem, not focusing in on just the individual, but, all the way from the government to employer practices and, everything in between, and then us focusing in on the individual behaviors that we can do to really promote better brain health. So I'll stop there and give it back to Lisa.
Thank you for that, Dr. Barnes. And, I love the things that you're talking about and how they kind of fit with some of the things that we've talked about in earlier episodes, the 6 pillars of brain health, those healthy behaviors. I know we've got some questions coming in the chat, and we are going to come back to those in just a little bit. But next, I'd like to invite Sarah Locke back up on the screen. And Sarah is going to talk with us about gender disparities in dementia and brain health and what current science now tells us about them and what the Global Council on Brain Health has to say about what women in particular can do to improve our brain health.
Thank you, Lisa. And Dr. Barnes, thanks for a fabulous presentation. You're just so clear about issues that are often seen as very complicated, but you make it very clear what we need to do. And it's just such helpful information. But now I'm going to talk about women's brain health because people are very unaware of the fact that women in general are far more likely to have dementia than men. About 1 in 5 women above the age of 45 will develop some form of dementia in their lifetime. But you'll see by looking at this chart that it's twice the rate of men, which is stunning. So why is it that these diseases of the mind are affecting women at far greater rates? Is there some special genetic factor for women? The research up until this point has been stuck in the notion that, oh, well, women live longer, they have greater life expectancies. So, of course, they're going to have this disease that's most common in older ages. But over the last decade in particular, we've learned that it's not simply because they live longer. Dr. Barnes has talked about some of the social determinants of health that affect brain health for people of different races and ethnicities at different rates. And again, we're going back to some of the environment and some of the issues that how people live their lives influences their risk. One very significant factor is that usually dementia caregivers themselves are women. Now, this is true for formal caregivers in the workforce who get paid to deliver this care, home health workers, for example, or nursing home workers, but also unpaid care. In fact, part of the largest way our healthcare system works is through voluntary family members and friends providing long-term care for people. And if you look at who's in the majority providing that care, it turns out that it's women. And if we don't do anything to change the trajectory of the disease, 13.8 million Americans will have dementia. The vast majority of those will be women, and the vast majority of the people caring for those will be women. And so you see why we say that this is a matter of gender equity as well. So interestingly, the strain of caregiving is thought to be a possible contributor into some of the factors why women have a greater burden of cognitive issues in later life. If you look at the kinds of care that women caregivers as opposed to male caregivers are giving, women are 2.5 times more likely to be providing around-the-clock 24-hour care to their loved ones. That kind of a burden, scientifically and anecdotally, is creating an amazing amount of stress on people. And women tend to have less in the way of income, less in the way of retirement savings, and less in the way of resources to deal with these issues. So this kind of a burden we need to address through social policy, through economic policies, to try to support women's life experiences and help them with their own risks to their own cognitive mind for all of the services that they are providing their loved ones and their families. So we took a look at this, and this was not just a Global Council on Brain Health report, but ARP brought in others who are working on these issues. A great partner was the Women's Alzheimer's Movement led by Maria Shriver, and the work that they've been doing now for several decades to try to fund and support women researchers. Because although you can't tell it now, if you look at this webinar, Dr. Barnes, for example, is one of the few, relatively few speaking relatively, both African American and female researchers operating in this space. And for years, a lot of the research was not examining women or even having women participate in clinical trials. A law was passed to try to change that, and now it's becoming better, but we still need to analyze the data that we have about women, and in particular, women of color, who have traditionally not been as much represented in clinical trials in the past. You know, there are reasons that we need large numbers of people to participate in research in order to come up with credible answers. But we also need deep dives into specific to understand, for example, what are particular issues for African American women or Hispanic women, because these factors, these multiple isms that we talk about, are necessary, because in order to tease apart the different factors that are causing the issues, we need significant numbers of people. And I've just described, because women's role in this world is very complicated and they're often working financially to provide, plus providing the family care, it's pretty hard to get them involved in some of this research because they may not have the time to get there. But long story short, the Time to Act report was seminal in saying, we know now what some of the problems are. What are the 5 things that we're going to have to do so that 10 years from now, we're still not complaining about lack of evidence, and instead we're moving forward. And the 5 things that our experts and advocates and policy thought leaders put on the table is, first, we have to eliminate stigma, because there is a huge barrier in addressing these issues because people are so afraid of the disease. We need to empower women and make sure they understand that that they have a role to play. This is part of the reason that this webinar is so important, is that we need to give the message to women that there are things they can be doing. And ensuring inclusive research and letting them know it's important for them to engage and participate and find ways to support their participation in research. And supporting caregivers so that they are not carrying this heavy burden alone without support from their employers or without support from for leave. And finally, to improve training of healthcare providers, because lots of times healthcare providers will actually miss the clues that women are coming with when they are going into the health system seeking answers. So those are the 5 particular steps that we're talking about. And I'm going to go back and, as Dr. Barnes did, talk to you about these 8 elements that the Global Council focused on. And these 4 that are highlighted are the ones that I think are particularly important for women. And the employer practices, as Dr. Barnes talked about, supporting caregiving leave and respite leave. We've been making some progress over the last few months. Medicare, the Center for Medicare and Medicaid initiatives is putting forward a dementia care pilot, where in fact we're trying to get resources to caregivers for people providing care for people living with dementia. It's called the GUIDE program, and we're trying to encourage healthcare systems and support services to work together and apply to provide those services where we can actually begin to get some respite paid towards breaking up the extreme burden for caregivers. And of course, that would be applicable for men and women caregivers alike. But employer practices, you know, you spend most of your life at work. You don't spend most of your life in a healthcare setting. So if your employers are creating opportunities for you in the workplace and finding ways to help support your sustaining healthy behaviors, whether that's sleep, you know, do your employers expect you to work around the clock? Are they giving you enough time off and rest and respite to meet your other responsibilities? Are they encouraging healthy eating? Are they giving you the health and mental benefits in the system that might support you? Are they giving you active training? Part of maintaining your brain health is keeping and stimulating an environment and creating opportunities for training and growing. Are they creating the environment which it's possible for you as an employer to do your job well, feel job satisfaction, or are they wearing you down? So families and caregivers, I talked a little bit about that. I know that I'm running low on time, but I'm going to talk about how healthy behaviors and community engagement can support it. Social isolation is a huge factor. It's one of our pillars that you stay socially connected. Communities have a great role to play in how easy that is, and culturally competent community activities in which people feel welcome in their community and participant and feel a purpose in life goes a long way from individual factors to help you support your own brain health. So I'm going to take it back up a little bit to talk about everybody. AARP has done a lot of surveys over the years because we constantly are trying to find out what people as they age are worried about and what they're concerned about. And that's why we've put such a big initiative and effort around brain health, because our members, older adults 40 and older, overwhelmingly are telling us that brain health is important to them and that they want more information about what to do about it. And if you ask folks, are they exercising? Are they eating the right things? Only about 56% report that they are, in fact, exercising and healthy. I think actually it's a wild exaggeration. People tend to think that they're exercising more and that they're eating better than they actually are. If you look at the facts behind that, a lot of people are not engaging in these 6 pillars. And that's why it's so important to create systems to help sustain them, so it makes it easier for folks to do this. But the other questions that we ask is, so what's getting in the way of you instituting these healthy behaviors? People will tell, well, if people around me aren't doing it, it makes it much more difficult for me. But if I've got a role model, or if I have a partner or a friend who will keep me honest and go for a walk with me, it's what others around you are doing that makes it easier. And so that's what's really important as we go forward, is the community involvement, so that people see and understand that this is a good way of living and thriving. I know Lisa said that in previous webinars, we've talked about the 6 pillars of brain health. I think the other really important message here is that you don't have to do all of them all at once. It could be pretty overwhelming if you're like, okay, I heard about these 6 pillars. I got to do all of these things all right now. Well, the sooner you institute them, the better, and the more you do, the better. But the most important thing is just take one step to get started. Set a goal, identify one specific action that you're interested in. Don't pick something that's the hardest on this chart. If it's adding more vegetables to your diet, just do that for a while. And once you're successful, you will understand that you can incorporate things slowly over time. And a lot of people say, I just don't have time for this. I'm busy, I'm caregiving, I'm working, I'm trying to meet my kids' needs. We spend shockingly amount of time on social media and on television. And part of the reports that AARP and the Global Council have put together, just how much time we unfortunately spend in front of the television. And I'm not saying don't ever watch television, but if you repurpose 15 minutes a day of that time, and instead do one thing, maybe sleep more, maybe walk more, you'll find you have time to slip one or more of these things in. And don't try to do it alone. Find somebody who's willing to keep you honest and set a date to go do something, whether it's a partner or whether it's somebody at work. Maybe it's a health counselor who can help you manage stress. If you involve other people, you'll find going to bounce it back up to my friend, Lisa Cooper.
Thank you so much, Sarah. So much important and fascinating information. And I see we have a lot of questions in the chat box. People can continue to put your questions in the chat box. Again, that is right underneath the screen here where we are playing. The video is playing. And I'd like to invite Dr. Barnes to come back on the screen with us too, so we can continue the discussion together, and we'll answer as many of your questions as we can here on our live program. So thank you again. Hey, let's get started here. I see we have a question from Daj. I know Sarah had mentioned some raw numbers of people who have dementia. Daj is asking, will the majority of people in their 60s to 90s experience some degree of dementia?
I could start, Sarah, on that one, because I think that's a really great question. What we've learned is that although Alzheimer's disease is very common, and it definitely is associated with age, so your risk increases as you get older, we know that it's not inevitable that you will definitely get Alzheimer's disease. So the answer is no. I think that what we've been trying to convey today is that there are things that you can do to reduce your risk. So don't think that just because I'm getting older, I'm definitely going to develop Alzheimer's disease. We have learned we have so much room for hope with this disease. And so I think that if you adopt some of the things that we've been talking about today, that you can reduce your risk, and you don't have to feel like, that you're definitely going to get Alzheimer's just because you're getting older.
A couple other questions here. I'm going to go kind of fast so we can get as many as possible in. I see Dale is asking, are the gender and racial ethnic disparities additive? Does the data show that, for example, that African American women are have higher incidence of dementia or likelihood of dementia than white women or African American men?
That's a great question as well. We don't have a lot of data to look to see if it's additive, but there is some suggestion that if you are from a minority background and also a woman, that your risk is increased. So there are a few studies that have shown that Black women in particular either have a higher risk or they're more likely to get Alzheimer's earlier. But, the data are a little sparse. And so we really need to do more studies in that area. But it does suggest that it's sort of a double whammy, right? Coming from a minoritized background and also being a woman does seem to increase your risk slightly.
So I lost a little bit of bandwidth, so I wasn't sure what happened. I was hearing Dr. Barnes's response to Daj's question. I just wanted to add in, it's a great question, and the majority of adults think they're going to get dementia. In fact, ARP did a research survey, and they showed that 60% of adults 40 and older believe that it is at least somewhat likely they're going to get dementia. And I think the numbers in reality are more that only about 12% of people over the age of 65 are likely to have dementia so significant that it affects their lives. So the numbers are slightly higher you might have some kind of mild cognitive impairment or some challenges with your cognitive aging. But it is by far not inevitable that you're going to get dementia or even cognitive decline. By the time that you reach your mid-80s, however, the numbers are significantly higher, and you have anywhere from a 1 in 3 chance is the highest statistic that I've seen, at 1 out of 3. But, even though adults are freaked out about this, everyone is worried that it's coming for them. And because it's a scary condition, if you think about it and the people you know in your life, there are some super agers that are incredible. So if you look at those people in your lives who you know are not have any issues, or your brain changes. It's completely normal for your brain to change as you age, but you still have strengths when you're older. Your brain and your capacity to engage in life, your ability for emotional intelligence, social connectedness actually improves well through your later years. So I want to make sure that people know that this, not only can you reduce your risk, which is the most important message that Dr. Barnes was giving, it is not inevitable. And having the confidence to know that what you do is going to help. But even if you do not prevent dementia as an individual, if you can delay the period at which you're living with serious disability, that's huge. So I think that the hope here is, even if you want to delay onset as long as humanly possible so you can enjoy a wonderful adulthood.
Thank you for that, both of you. A couple of questions that we have, I'm going to maybe address together about people looking for services, for resources. You mentioned about, that maybe a person's primary care physician, while we always say start with your primary care physician, maybe they're not necessarily up on getting connected to specialists in brain health. So I know Alice was asking about trying to connect with somebody, a specialist in Southeast Michigan, and we have guests from all over the country with us. I know that in the chat, our one of our producers has put in a link to our AARP Dementia Resource Guide that has information about how to connect to different types of services, including opportunities for clinical research in your area. Also, after this program is done, you'll continue, all of you who are watching, to be able to access our resources that we have included under the resources tab for each program in this series. And that includes, again, that dementia resource guide for individuals and families. One of the things that I know we have in most states is an Alzheimer's disease research center. So that is always a good place to start. I don't know if Dr. Barnes or Sarah, if you want to add anything to that about finding specialists in your area.
Yeah. In addition to the many great resources that AARP has and that are in the chat, there's also the Alzheimer's Association, a really great resource. There's a chapter in every state. You can Google Alzheimer's Association. They have a hotline, 24-hour hotline, actually, that you can call, and they can, anything that you're going through, whether you're a caregiver or a child, an adult child who has a parent with Alzheimer's, you can call the hotline any time of the day and get connected to resources, or just have someone to listen to you. If you want to vent because you're stressed out, or you just don't know what to do. I really encourage people to check that out. And as Lisa mentioned, we do have the Alzheimer's disease research centers. They're not in every state, but there are 37 centers. And so there's definitely one in Michigan. It's actually in Ann Arbor, and it actually covers Grand Rapids, Detroit, and Ann Arbor. And some really great work going on there. And they also have a clinic so that you could call and try to get an appointment. But if you feel like your PCP needs some support with understanding brain health, PCPs are very busy. They're trying to manage a lot of different things in a very short amount of time. And we can't expect everyone to be an expert in brain health. I would encourage people to really be advocates for themselves. And, if you see that something's wrong, something doesn't feel like it used to be, and you're not getting anything from the PCP, try geriatricians. They know a lot about brain health. Neurologists are, specialists in, there are neurologists who specialize in dementia care. If you can get into a neurologist, that's great. But sometimes, it's hard to get those kinds of appointments. I would definitely start with geriatricians, or even a family practice doctor who really knows the entire person. I just think being an advocate for yourself, because your brain better than anyone else. And if you notice changes, don't think, oh, this is just supposed to be happening, I'm just getting older. No, it is not. You should go get checked out. If you feel something's not right, go get checked out. And there's so many resources out there, not including the ones that I've just mentioned.
So PCP, primary care physicians, we always say, start with your primary care physician. But what I'm hearing you say is don't end there.
Right, exactly.
It feels like you're not getting the answers. You got to take on the role for yourself, for your family member, for your friend that you're helping out, and be an advocate and continue to look. Hey, and something you mentioned too that was related to a question that we had. A couple of folks, I think Pamela had asked again about, is there a place that you can just call and cry your eyes out when you've had enough? This is something that I know AARP, we can go to our aarp.org/caregiving website, generally information about and support groups for caregivers. Also, there is a hotline, and you mentioned the Alzheimer's Association hotline. That number is in our resource guide as well. But from what we heard from Sarah, I mean, that is important on multiple levels, because you as a caregiver, you want to be in the best position to continue providing care for your loved one. But we also heard from Sarah, the research now shows us that stress on our minds and our bodies from being a caregiver then increases our risk. So very important that caregivers are practicing self-care. Hey, just a quickie here, but it might segue into some other conversation. Somebody's friend has heard that coconut oil helps dementia. Is there any truth to that?
So there has not been any clinical trials where people, it's a type of research study that's considered the gold standard to really answer a question, where people are randomized to either get a treatment or a special diet or a special activity, and compared to someone who doesn't get that, called the placebo group. There have not been any clinical trials that have shown that coconut oil prevents Alzheimer's disease. And there are many things out there that people think, help, but really you want to go and look at the evidence, what has been shown in clinical trials to really be helpful for preventing the disease. And right now we don't have any evidence that coconut oil is helpful.
I know, Sarah, the Global Council on Brain Health looked into this.
Yeah, in a report called The Real Deal on Supplements, we looked at some of the most common, what they call nootropics, or supplements that people have heard of to promote brain health in some way. And so I encourage people to take a look at that. They can get it at the Global Council on Brain Health's website. But lots of people are looking for miracle cures. And as Dr. Barnes was talking about with coconut oil, there are lots of things that you'll see on television that promote brain health. And if it sounds too good to be true, it's too good to be true.
Yeah. So I think I saw an infographic that you had, save your money, honey, when it came to whether it's worth it to buy some of these as seen on TV. A question going back to some of the stuff that Dr. Barnes was originally saying. You talked about the impact of the social environment on whether people are likely or more likely to develop dementia. So are those environmental factors more important than somebody's genes, than their genetic makeup?
That's a great question. I don't know if I would say they're more important. They're definitely as important. We know that there are a number of genetic risk factors for Alzheimer's disease, but they appear to operate a little differently across different racial and ethnic groups, which suggests to me that there must be an interaction between the gene and the environment where you live. So understanding your social environment is as important as understanding your genetic makeup. And in fact, there's been many studies that suggest that your zip code where you live is more important than your genetic code. So really, I think understanding the two together is going to be key, but it's clear that we have much more control over our social environment. That's why I like to focus on that, because you can actually change things in your environment. You can't change your genes, right? It is what you have. So good question though.
Yes. And one more quick one before we move into the closing segment, from Peter, asking about if there's a hormonal factor that correlates to the fact that women have more experience of dementia. And I know, Sarah, we talked about this in the book, The XX Brain.
That's right. Lisa Mosconi, also a Global Council on Brain Health expert, has written a book around this, and we're learning more and more that in fact there is some kind of relationship between fluctuating hormones for women, and there's a lot of science now going into that. There's been great controversy over the years about hormone replacement therapy, and a scare suggesting that if you take hormone replacement therapy, it will increase your risk for cancer. I would really have a conversation. If this is personal for you, I would definitely have a conversation with a gynecologist if you're a woman, your primary care physician if you're a man. But the facts around hormone replacement therapy, it's critical the window in which you would be receiving this hormone replacement therapies. And we don't have time to get into it right now, but it is not a simple matter. And you should get advice from your healthcare practitioner about that. But you don't, the headline is, you don't need to be terrified if you're a woman and you're interested in hormone replacement therapy during your menopause years. You should look at your individual risk factors for cancer and make decisions about that in conjunction with your healthcare provider.
Well, thank you for that. And unfortunately, we are almost out of time for today's program. But before we go, I want to ask each of our speakers one final question. And I want to remind you that you can find the links to a lot of the resources that we talked about today on the event page for this series. If you click on the resources tab underneath where the video is playing, and you'll be able to continue to access that event page. And there you will also find a recording of today's program and all of the previous programs from our Disrupting Dementia series. So if you want to go back and hear more about the 6 pillars of brain health, if you want to go back and hear more about how to have more successful conversations with your doctors, please go back and you can watch those other episodes on demand. But let's hear once more from our guest today. Dr. Barnes, we've heard a lot today, but what is the one thing above all that you hope people will take away from today's program?
I would say that we all can build a better brain as we age, and that brain health equity is a responsibility that we all have, and that is really important if we're going to change this disease for future generations.
Amen. And AARP Senior Vice President Sarah Locke, what is the one thing above all that you hope people will take away from today?
The very same actions for healthy living that reduce your risk for cognitive decline as you age are the same things that can improve your quality of life, even if you should have these diseases.
Yes. Whether or not you have dementia, these things are good for your body and brain. As for me, I hope that each of you at home has found something useful to take away from today's program and all 4 of the programs that we have offered in this AARP series. And I hope you've learned something new that you can use in your life, and beyond that, that you feel inspired to reach out and share what you've learned to help make a difference for yourself and your family and friends and in your community. You can feel free to continue to share the link for this series, which is aarpmi.org/disrupt2023. And I know it's in the chat links as well. And there you will be able to continue to access all these programs and resources. Thank you again for joining us today, and be well.